Welcome back. Pop superstar Lady Gaga is no stranger to the spotlight. This includes both entertainment and societal platforms. She is a vocal advocate for different issues like mental health and gay rights. But now, the singer is sharing her personal struggle with fibromyalgia. She says the disease is the reason she canceled the European leg of her concert tour this week. Joining me tonight is Michael Egan, who's an integrative medicine provider at Allina Health. He is here to tell us more about this chronic pain disorder and how to treat it. First of all, Michael, thanks for being here tonight.
Thanks for having me, Liz.
And let's talk about that. What exactly is fibromyalgia? Because it seems like it's a little bit all over the board.
Yeah, so fibromyalgia is characterized by chronic pain, chronic muscle pain. And there's a myriad of other symptoms, including fatigue, sleep disturbances, often anxiety and depression. Mental challenges like short-term memory can be affected. Some people call it fibro fog, as well as headaches and just pretty much an overall reduction in quality of life.
What can cause something like fibromyalgia?
Well, we don't know exactly. It's probably not one single factor. More likely, it's a myriad of factors. But we do believe that things like illness or infection can have an effect, gene mutations. And also, there's pretty good evidence to suggest that people with a history of emotional, physical, or mental trauma are predisposed to developing chronic pain.
And let's talk about chronic pain. I mean, it sounds simple enough that chronic pain is different, but it really is.
Well, there's basically two types of chronic pain, right? There's acute pain and chronic pain. Acute pain, let's say you step on a nail, and it hurts. And it hurts because it's a normal way for you to be alerted that something is wrong, so you can address it. So you get rid of the nail, you clean out the wound, you maybe go and get a tetanus booster, and you have some pain for a while and it resolves. But chronic pain is different. Chronic pain can have factors that we know it's causing it, like somebody who has cancer, or things like fibromyalgia where we're not quite sure, but maybe the brain is actually processing pain signals differently, almost like a magnifying lens on the pain. And this can last for months or years, and it actually creates changes in the nervous system, making us more sensitive to the sensation of pain.
And I guess that's the big question here, right? Is chronic pain curable?
Yeah. There's no magic bullet, there's no simple answer, but I think that it's important to acknowledge that pain is part of our human experience. So the idea of never having pain is probably not realistic. But it's, I think, treatable in many ways, you know, and we used to look at medication, right, and trying to treat it with things like opioids. And we know now that that doesn't work. We're in the midst of an opioid epidemic. And actually there's some evidence to suggest that in chronic pain, long-term use of opiates actually makes it more difficult to treat. So we encourage people to take a little bit more of a holistic approach. We offer people acupuncture, traditional Chinese medicine therapies like Tai Chi and Qigong, so mind, body, breath exercise, meditation, therapy, cognitive behavioral therapy can be very useful as well, and things like yoga.
And yeah, that's what I'm wondering. Has there been some success then with these alternative treatments?
Yeah, I think you know, complementary medicine can be very, very valuable. And at West Health, we have an integrative pain program where we combine neuroscience education along with traditional Chinese medicine education and mind, body, breath exercises, meditation, Tai Chi. And some people have had dramatic decrease in chronic pain. And a lot of people say, you know, I still have pain, but the quality of my life is much better. And it's no longer, you know, screaming in my face all the time. It's a little bit more like background noise.
Thank you very much, Michael, for being here tonight. And if you would like more information on fibromyalgia and how to treat it, you will find a link at WCCO.com/links.